This is what ACHL have done and are doing around ensuring that the homelessness issue is responded to proactively. So about 30%, 29.3% of our new allocations could classify as being taken up by people who, if we hadn't had those allocations to provide them, would have been in a homelessness or no shelter situation. Affordable community housing has many partners to enable the identification of risk and to ensure that people are informed of their choices and understand about how they can work within the system. We also try to move our people through to affordable housing. That's a goal, to provide them with employment opportunities, to employ them. We have an Educational Foundation award which we allocate to families in need of financial assistance for their children. We also have a physical education award to help people with their sporting activities. So we try and wrap around support by a number of things. I think the most challenging thing is getting into the system for people. And there's now something that you've probably heard about being the Common Pathways system. That means that whatever your provider is, whether it's public or community, there is one waiting list in. And there's some challenges in that. There's some really good things, that it's meant to be fair and consistent and we go through the same way. But there's also some challenges because it is a system that rates people by priority, sometimes with multiple priorities, which is really what many of our people in social housing have. It's very hard then to place them in a manner that reflects their need. And so what it really requires is very good triage, just like in hospital, so that there's someone who is able to work in a very skilled manner in that front desk way, and to really identify the level and to know how to advocate and to know how to manipulate or use the system to make sure that those people with the greatest needs really get the best opportunity for them immediately. And very often what it might mean is that we also we place people in short-term accommodation or leased accommodation. Sometimes when they're in that accommodation, they then find it very hard to access other support services because they're not in there for very long. So there's a really difficult spot in that immediate access point, and I think that's a real challenge that we can focus better on. So also, as you all know, lack of housing is often the first crisis contact point for so many other needs. So again, it's an area that requires good referral skills to be able to work in that way. And I think that the other points are indicative of what I've already said, that we need to really look at the skill levels and professionalism of our staff in housing and to make sure that we're able to attract those sorts of people into working in that area. I'd now like to talk just for a minute from the perspective of being the chair on the board and the sort of governance issues that we face. First of all, we're a skills-based board, so people are not there because of an area that they represent, which means that we don't take tenants on the board because they are tenants. So we do have a tenant on our board, and she is there because of her business skills, not because she's a tenant. Now, it's a tricky line to manage, but we do have other ways for our tenants to be engaged, which I'll talk about in a minute. One of the challenges that we've had is, because we now can build property, is managing the huge financial challenges around that. So our board has to be very skilled in financial administration, and we're very lucky to have some very financially articulate people, as well as some people who can understand financial decisions. So, and it's challenging as to how much we grow in this area, how fast we grow, because it has been an area where we can grow. There's so many opportunities for partnerships. For example, we're partnering with places like Lifetime Care to help to develop group homes. There's a group of very active parents who have children of disability, and we're partnering with them to build homes for their older children so they'll be safe as they get older. So we very actively seek to partner with others than the government to build homes appropriate for the groups that are in need. We also have partnerships with Marist Youth, and we have a joint venture with Catholic Care in Tasmania, where we're really providing the advice as to how to do the property development and manage the compliance so that they're able to have property transferred to them and to build property. And we're seeking to do that with other areas of Catholic Care. Okay, and with our tenants, we seek to engage our tenants through a number of ways, and Mohammed will speak about that more shortly. We do have tenant committees in our local zones. We do surveys. And the challenge is to making sure that we seek the voice of the homeless, because they're not represented. And we've done various things to try and engage with that voice, but it's making sure that we hear that voice. It's quite hard. Some of the things that we've done is, of course, work closely with our support partners, do the city walks with the homeless, but also make sure that we look at those temporary accommodation things, caravan parks, and to connect with services such as MAMRE to make sure that when there is an issue, people can come out and talk to those people. This year our portfolio grew by 101 properties. Many of those are blocks. We now develop... sorry, I've mentioned that. And I've mentioned also that we're also liaising with Perth and Ballarat Centre Care to provide advice. And we take quite a lot of customer surveys, our tenants are our customers, to make sure that we refurbish their places and respond quickly to maintenance issues. Those are some of the areas that we've provided tenant support with. And some of those I've mentioned. The scholarship scheme. How much do we have in the scholarship scheme, Mohammed? How much is our... Yeah, 100,000 is in our scholarship scheme. We allocate that to various, in different ways to families that put up a case to show that they are supporting their children in education. Okay. We have had we are hoping to have a number of people transition to long-term housing, affordable housing. And again, Mohammed, are you able to say whether or not we've had anyone transition from social to affordable housing? Yeah. Do you want to come up and speak? Have you got a loudspeaker? Yeah.
Can we have another speaker? Yeah, thank you.
Yeah, great.
Do you mind if I just say a word or two about
that?
I just want to say that in another life I've met Mohammed through my ABC work. I have been lucky enough to be at his home for iftar. Now, iftar is the breaking of the fast during Ramadan. At the end of, as soon as the sun goes down, having fasted all day, the Muslim family has a rather delicious meal. And I got to meet the family then. I just want to make the point, though, that Mohammed came to this country as a refugee and has ended up a key leader in the Sudanese community here. Somali community here, beg your pardon. And not only has he done that, he's now making sure that the rest of the community has affordable housing, and he is now the General Manager of Housing Services for this organisation. We're talking about affordable community housing. Please, Mohammed.
As Rosemary mentioned, the affordable community housing, we are not just establish our business or our entity just to provide shelter. So we try to do more than that. So we would like to do many programs and activities that is aimed to enhance the circumstances of those tenants we house. So in other words, that we want to improve their well-being. So by doing that, we will move them from homelessness, transitional housing to affordable housing, and we have been successful for doing that, especially for our youth homelessness. About 60% of our youth homelessness, they arrive at our services. We provide a shelter through the emergency accommodation, in partnership with other service providers and moved to transitional housing about 2 years or so. And most of them, they are in the workforce and got a full-time employment and moved to affordable housing. And our idea is that housing is not a destination, it's rather a means to achieve people's dreams. So by doing that, so those youth people or those young people, they can really own their own property in the long run if they got the financial means to do so. So our programs are crafted around that. So what we provide is the economic empowerment through employment. Also, we provide relief through the budgeting constraints by providing financial education assistance, as Rosemary mentioned. This year, or last financial year, we have provided $110,000 from our internal resources to our tenants to help them educate their young kids, because we know that those parents, they have got a circumstance beyond their control. They don't have the means to achieve what they want to achieve. So we are here to support them so they can invest in their kids, so the kids could have a better life in the future. We don't want the circle to continue, so we want to stop the revolving door there. And the other programs also we provide to our tenants is free food through Oz Harvest. So to date, about from July 2010 until now, we provided 35 tons of food to our tenants. And speaking to some tenants who received those food, they told us that saves about $50 to $30 a week on their budget. So on one hand, we are reducing their financial stress, but also at the same time we are giving a well-balanced diet, because the food comes from different sources and they are all nutritious food, which they didn't have ability to buy those foods in the past. I don't want to hijack what Rosemary was saying, but I think that's just some of the program, but you want me to talk about...
what I'd like to do now, Mohammed, is I'd just like to show one more slide about the gaps and opportunities that I think we can identify. And then Mohammed and Andrea will just perhaps discuss a couple of questions, and then I'd like to open it up to the floor. Okay? So these are some of the things that over about the 5 years that I've been engaged in the housing sector, I've certainly noticed, and I'm sure many of you have too, that it's hard to get coordination between providers, so support providers, and between government departments, so that people can move seamlessly from being in stress to being housed, and that we get all the information about that person as they go through as well. It's very hard to find out the whole story quite often, and to have benefits tracked properly, and to have people having all of the opportunities that they could possibly have. So, for example, I think in our last board papers we've just got an agreement with the police that we can share information if we need to, whereas previously we hadn't got that. And that can be something that's really important to keep people safe from many directions. I've mentioned before that I think that the way that we do triage for people in need, whether they're refugees, long-term unemployed, elderly people, whatever, but the way that we assess the need and communicate that need and advocate around that and get them into the system at the right level is a gap.